Bismillahirrahmanirrahim. So this is paper number 6 2014. So over here, after prostatectomy, which layer of the fascia is kept open? This is a poor recall. So coming downward, the actual MCQ is here. After prostatectomy, the patient developed a rectourethral fistula, a rectovesical fistula, but most common rectourethral fistula. So which layer should have been preserved to be on the safe side? Now the answer over here is the D is the right answer. D is the right answer. Coming next, effect of sympathetic system on carbohydrate. Now the A is also right. It increases the glycogenolysis, because in the liver we are having the beta receptors, and whenever there is a sympathetic stimulation, so the beta receptors then actually convert the glycogen into the glucose. So this is the right answer. But the B is also right. The alpha receptor suppress insulin. The alpha receptors, but which alpha receptors? 2. Remember, 2 is always in the pancreas, 1 is always in the kidney. So beta 1 and alpha 1 belongs to the kidney, beta 2 and alpha 2 belongs to the liver. So over here, the beta 1 antagonist, it is actually beta 2, point number 1, not beta 1, and it is actually the beta 2 blocker actually decreases insulin, not increases insulin. So the C is the wrong option. C is the wrong option. So you are having A versus B, so there is a tie. So if there is the word except, so the answer is then C. The answer is then C. If there is no except, then there is a tie between A and B. A is also right, B is also right, because the alpha receptors, they can suppress insulin. But now you have to focus on the alpha receptor, what? Stimulation or blocking? You have to focus on that, or blocking. Whenever the person is having hypoglycemia, there is sympathetic stimulation. And that sympathetic stimulation then causes what? Then causes increase in glucagon. So here I will give you the reference. Coming toward that reference, so this is that reference, that is the adrenergic stimulation. So whenever the beta receptors are stimulated, the beta 2 in the pancreas, what will happen? The beta blocker causes what? The beta blocker causes decrease in insulin production. The beta blocker. The beta agonist or the beta adrenergic stimulation increases insulin. Similarly, in the alpha 2, the alpha 2 stimulation causes decrease insulin release. Here is the reference of the Genong book, and this is one of the most trusted book for the fcps purpose. So whenever the alpha 2 is stimulated, there is decrease in insulin production, and whenever the alpha 2 is blocked, there is increase in insulin production. So just read this paragraph. Adrenergic stimulation has dual effect on beta cell, that is the alpha 2 adrenergic inhibition of insulin. Now here, whenever the alpha 2 adrenergic receptor are stimulated, it causes inhibition of insulin, and when the beta 2 are stimulated, it causes what? It releases insulin, but the release of insulin due to beta 2 receptor agonist is least as compared to the insulin inhibition by the alpha receptor. Like suppose this is a pancreatic cell, you are having the beta cell and you are having the alpha 2 cell. If both are stimulated, the message that comes from the beta 2 and the alpha 2, it is inhibitory and it is excitatory. So there is a competition between the two, but the inhibitory reflex is more powerful then the stimulation reflex. So the net effect is decrease insulin production. I think I am clear over here. Coming back toward the MCQ. So the alpha receptor suppresses insulin. That is the right answer. But the alpha receptor stimulation, not the blocking. If the alpha receptor is blocked, there will be increase insulin. But sympathetic system causes what? If sympathetic system is activated, we already discussed, it will cause the alpha receptor activation, and when the alpha receptor is activated, it causes what? Decrease insulin. Coming next. Which of the following is associated with spleen? Now, solid organ causes what? Coagulative necrosis, except the brain. In brain, we are having liquefactive necrosis. Coming next, left renal vein explained in the previous video with diagram. It lies anterior to aorta, and it is longer than the right. Person not able to open the mouth. The lateral pterygoid is the right answer. He is not able to open the mouth. Lateral pterygoid helps you to open the mouth. It is the right answer. Tidal volume affected. There is decreased compliance. Because compliance is equal to volume by pressure. So if tidal volume is affected, it affects the compliance. 13-year girl, xray of the elbow joint, secondary center of ossification. Now from 11 to 13, the answer is D, lateral condyle. In my first video, I explained with diagrams, and there was a mnemonic for that. I also quoted that mnemonic and explained in detail in my first video of the SK Gynae Pink. You can search it from there, and I have given my link on my Facebook page to the all SK Gynae Pink video. I have arranged a separate playlist. Estrogen will not increase the risk of it will not increase the risk of CA ovary. If that is not in the option, then CA gallbladder. It is said the estrogen has got protective role for the CA ovary. Estrogen has got a protective role for CA ovary, because whenever you are giving estrogen, it causes decreased ovulation. So decreased ovulation has got a role in protection of CA ovary. So the answer E is right. Reference is MRCOG part 2. Infection in the superficial gland pouch goes to, now coming next, that is greater vestibular gland. The B is the right answer. While the C and D, the bulbourethral gland and the Cooper's gland, are two different names for the same thing. Regarding fibroblast, produces amorphous substance, but regarding the fibrocartilage, that is excess in collagen. So you have to focus on the fibroblast and fibrocartilage. Fibrocartilage, you are having excess collagen, and fibroblast, it produces amorphous substance. Premature ovarian failure association most commonly autoimmune disease. But in the absence of autoimmune disease and the age is less than 30, what would you do? Karyotype. There is MCQ on this, and I already discussed in detail. You are excluding which syndrome? Turner syndrome. You are excluding which syndrome? Turner syndrome or Y mosaicism. Which of the following is associated with thrombocytopenia? Thiazide diuretics. That is the right answer. Coming next, vitamin D, we do test in the laboratory. That is 25 hydroxy. That is the right answer. 25. That is 25 hydroxycholecalciferol. That is the right answer. That is the right answer. Abnormal curve in lumbar spine, scoliosis is the right answer. Curvature is increased. Lordosis is the we are having scoliosis and we are having kyphosis, but the kyphosis is not mentioned over here, so the answer A is right, scoliosis. Boundaries of posterior triangle, sternocleidomastoid, option C is the right answer. Which vitamin is involved in the formation of clotting factors? That is vitamin K. But vitamin K was not an option, so the next best option is vitamin C. So coming next, newborn is diagnosed to have inclusion body conjunctivitis. Mother had vaginal infection. Possible cause is chlamydia. Chlamydia is intracellular. It causes inclusion body. Most numerous immunoglobulin in blood is IgG. And from mother to placenta, which is cross, that is IgG. But IgG1 or IgG4? The answer is IgG1. Share the reference also. Well, I'm also sharing some of the MCQ with references on my Facebook channel, that is FCPS part first, with Dr. and clinical points with Dr. Jangir. Uh, Structure leaving the thorax entering the root of the neck and again entering posterior mediastinum. So they're talking about the aorta. The aorta moves like that. So it leaves the thorax, enter the root of the neck, and again enter the posterior mediastinum. So they are talking about the arch or the ascending aorta. Phagocytes in the blood, neutrophil. I already shared a reference to this. Well, if you are having problem with my speed, if my speed is not comfortable to you, like I am very slow, I am very fast, so you can change it from the YouTube on the top. You click on that and there is the speed, so you can increase the speed or decrease the speed. So phagocytes in the blood is neutrophil, phagocytes in the tissue is macrophages. Hormone involved in the lymphocyte growth and development is thymocyte. This is the hormone that is produced by thymus gland. Thymocyte. If that is absent, the next option is growth hormone. Well, there are references I can share. So the thymocyte, if that is not, then that is growth hormone. Sorry, that is by the name of thymonin, something like that. That is released by thymocyte that help in the T cell growth and development. If that is not, then the growth hormone. I will share the reference on my Facebook page. And if the question says there is decreased production of T lymphocyte, the answer is cortisol. Then the answer is cortisol. Because the steroids, it decreases what? Lymphocyte. It decreases what? Eosinophil. It decreases what? Monocytes. And it increases what? The neutrophils. By which mechanism? By decreasing the neutrophil adhesion to the endothelial surface. Most common site of brain abscess. Now this is the frontal and temporal both, F plus T. If that is not in the option, then the answer is frontal lobe. Walls are present in, coming next, that is C, medium sized vein. Common step of glycolysis and glucogenesis is, that is D. So the step can move either up or down depending upon the requirement of the condition. Well, the answer is USMLE step 2. I will share the reference on my Facebook page. Organism causing Burkitt's lymphoma is, now Burkitt lymphoma is Epstein-Barr virus. There is another MCQ. Nasopharyngeal carcinoma has association with Epstein-Barr virus. So coming next, daily protein requirement is, that is 0.8 gram per kg. 0.8 gram per kg. So if you multiply the average weight of the person is 70, so you multiply that with this 0.8, that give you 56. So option 56 voila is the right option. Option B is the right option. Intracellular and extracellular potassium maintenance is by sodium potassium ATPase. Which of the following is associated with Wilson disease? Out of the given option, the D is the right answer. Nothing to be contradicting in that MCQ. Regarding facial nerve, now it supplies the posterior biliary digastric. The chorda tympani arises from the vertical portion, because if this is your facial nerve, if this is your middle ear cavity, so it enters your hair, then it comes posterior, then comes down. The chorda tympani arises from this part, the vertical part. Coming next, related to third pharyngeal are the stylopharyngeus. That is the right answer. Cholinergic fiber or the acetylcholine releasing fiber arises from, that is nucleus bacillus of Menard. That is the right answer. Coming next, change in the vascular resistance post-op. The answer is catecholamines. If the question is having norepinephrine, then the answer is that. But if no norepinephrine, then catecholamine. Well, the major stress hormone is cortisol. If that is not, then the next is ACTH. Now there is another question. Major stress hormone that causes vasoconstriction. This is norepinephrine. If the norepinephrine is not in the option, then epinephrine. How catecholamine causes uh, change in the resistance. The catecholamine increases sensitivity of the receptors of norepinephrine. Norepinephrine can work best. How? The catecholamine increases the alpha receptors, the alpha 1 receptors. When there are more alpha 1 receptor, so the norepinephrine can work more and causes vasoconstriction. CO2 diffuse easily into the brain, type of necrosis. Now in the brain always there is liquefactive necrosis. Protein requirement in 70 kg men. We already discussed that is 56. The right answer is missing over here. It is not 0.8 gram per pound, it is 0.8 gram per kg. Premalignant skin lesion. Most common is junctional nevus. Most common premalignant lesion of the skin is junctional nevus. But that is missing over here. So the answer is leukoplakia. Most lethal premalignant lesion is erythroplakia. Insoluble form of iron storage we already discussed, hemosiderin. Maximum glucose absorption is in the proximal convoluted tubule. So for today that was enough, and I'm busy in for a day or two, so I will not be able to upload another video, but I will definitely upload the day after tomorrow 2 paper inshallah in one video. The purpose is to give you idea how to study. So if you are not compatible with my an option, so it's your choice. I'm not going to compel you. And another MCQ I would like to clear over here is the dead space increases both in shallow breathing and it increases both in deep breathing. So you have to look for another option. It increases in both shallow breathing and deep breathing. Well, I will share the reference on my Facebook page. So it increases in both shallow breathing and deep breathing. So you have to find out the other option. It may be a poor recall, but the deep breathing I have shared the reference of Ganong, and for shallow breathing I have shared the reference the 2 to 3 references. Well, there was another video on my YouTube page, and there was people who were texting me that on video you said that was shallow breathing, and now you are sharing the reference of deep breathing. So I would like to clear this, that dead space increases in both shallow breathing and deep breathing. How in the shallow breathing? Because in the shallow breathing mean what? You are breathing like this. So if you are shallow breathing, then there is rapid breathing. So it is actually rapid shallow breathing. When there is rapid shallow breathing, there is CO2 retention inside the lungs. You are changing only the CO2 of the upper airway. But in shallow breathing, the CO2 of the lower lung is not ventilated. So if there is CO2 retention in the lower lung, so it means the amount of air that does not take part in the gaseous exchange is increased. That is common sense. So if that is increased, it means dead space is increased. Dead space is increased. In deep breathing, there is actually distension of the airways. There is more distension of the airways. So by that, it means dead space is increased. In supine position, the dead space is decreased. In the recombinant position, there is little effect. But if you are giving artificial breathing from the outside, then that has effect in the recombinant position. The dead space then increasing. Dead space then increases. So I think I am clear regarding this. So next video will be started from here. So if there is any query, you can ask in the comment section below. And there was another MCQ that if you put RBC in 0.35 in ACL, what will happen? Sorry, that was not the MCQ. What will happen to RBC? So there will be complete hemolysis if you put in 0.35% normal saline. The second option was if you put RBC in a hypertonic solution, what will happen in a hypertonic? It will shrink. That was also the right option. And option 3, that was also the right option. That if you put the RBC in the hypotonic solution, it will swell and burst. But these may be the poor recall, so you have to focus on exam. So the option A, B, and C all were right over there. But as I remember the MCQ from the genome, that it caused complete hemolysis at this concentration. So that was most probably the right answer. But you have to focus on the other options as well. Well, there's another MCQ, the 2,3 DPG. 2,3 DPG is increased in what? Then it is hypoxia. Hypoxia is the main culprit. So the increase in temperature was not the right option. So option B was the right option. That was hypoxia. Of course, option C is these can be the poor recall, so you have to focus on the hypoxia. Hypoxia increases the DPG. Hypoxia increases the DPG. Well, there are other MCQs as well. A patient is having, there was a scenario, a patient is having abnormal periods and she is having actually a lot of hairs on her body. So the answer is PCOS or drug. So in the stem they have mentioned actually she is shy to show her hands to the doctor. Now if she is shy to show her hands to the doctor, it gave us one clue that she is having actually hypertrichosis. He is having excessive hair on the hand as well. And out of the 4 options that were given in that stem, therefore all the 3 can cause in the androgen sensitive area there is increased hair production, while the drug can cause hair production all over the body, hands, feet. So you have to focus in exam the full stem. There are poor recalls. That's why I'm making the video, so that you get the main concept. If they have mentioned the hands, then the drug is the answer. If they have not mentioned the hand, then the PCOS is the answer. Well, I will give you another MCQ that a multiparous woman and she is having poor wound healing. Poor wound healing, what is the cause? Now this is the poor recall. This is not the whole stem. I have shared a lot of MCQs for that. They will give you the HB, they will give you the temperature. So if you preoccupy your mind that I have to choose anemia and the HB over here and the exam is 13 and you pick the anemia, that is the most common wrong answer and you will not get marks. So you have to focus on all the things. So if there is poor wound healing, you have to focus on the HB. If that is 12 and the patient is having temperature of 102 for the last 1 week, then infection is the most common cause. If the same MCQ, poor wound healing and the HB is 6, then yes, this is the most common cause. If the same MCQ and the person is strict non-veg, she does not like veg, so the answer is hepatitis C. So it depends upon from stem to stem. It is from stem to stem. So don't preoccupy your mind with the wrong answer. You have to focus on the stem as well. And that is actually the active and smart learning. And that is the purpose of my videos. I'm just discussing and opening your mind how to study. I'm not contradicting with anybody. Thank you for watching my videos, for subscribing and for sharing.